Hello, this is John Yates, and I chair the technology practice at the law firm of Morris, Manning & Martin. And I'm here today with John Freund, the founder and CEO of Jump Technologies. And we are here at the MMM Tech Podcast and MMM Tech Law and Business Report. And I'd like to introduce Michelle Madison, who is the chair of our digital health practice, who will be asking John a few important questions. So Michelle, why don't you unmute yourself and we will go from there. Thanks so much.
Thanks, John, and welcome, John. It's great to talk to you today. And I think I'd like to start out with just tell us a little bit about the elevator pitch behind Jump Technologies and what was the motivation for the company starting.
Sure. First of all, thank you for having me today. Jump Technologies is an inventory management company, SaaS-based business based in Minneapolis, Minnesota, focusing exclusively in the healthcare marketplace. We really focus on the analytics part of the business. There are lots of solutions out there for being able to keep track of inventory, but it's really the analytics side of it that is our strength. We have about 150 hospitals today running on our platform, some very large IDNs scattered all across the country and growing quite quickly right now.
So what makes Jump Technologies different from other supply chain management companies and the technology side? What gives you that unique edge?
I think it's really our focus on keeping track of inventory from the moment it lands on the loading dock until it's consumed by a patient. That means we have solutions for being able to receive and track inventory on the loading dock. We have solutions for being able to manage inventory, the floor stock that you would find around the hospital. We have solutions specifically in the procedural areas for being able to track implants and manage contracts and minimize charge capture loss and the like. Our competitors seem to be doing one of those things, but our ability to do that from doc to patient then gives us all the data that we need to produce very powerful analytics in near real time. So we know what's happening inside an OR suite while it's going on and have all of the consumption and purchase data the minute that case is closed. So it gives us a real edge on the analytics side, but that simple point of use data capture piece on the front end is what gives us the ability to gain access to all that data.
So you all focus specifically on healthcare. How has COVID impacted your business, and how do you see COVID impacting it moving forward, especially into 2021?
Well, as COVID was a major impact on everybody, it is a major impact to our business because obviously healthcare supply chain had a light placed on it and it wasn't glowing very brightly. The healthcare supply chain broke down and the cost of that breakdown was significant, both in terms of patient health, staff health. We spent trillions of dollars and a major impact to our economy. So the result of that is now suddenly hospital CEOs, hospital CIOs, the C-suite has basically said they have some major focuses. Number one is patient health and safety, staff health and safety. Number two is supply chain risk. CIOs, number one is telemedicine. Number two is supply chain. So there's a tremendous amount of attention being put on supply chain technology right now. Hospitals went from having a simple mask that cost them less than $1 that they could order today and it would show up tomorrow. Suddenly, those masks weren't available to them, and a lot of people suffered because of it. So now they really want to get visibility into all of that data, and they want transparency across the entire supply chain. So for us, it's good because we're very well positioned to do that because of the fact that we have traditionally managed inventory from doc to patient. That allows a hospital to know very quickly how much inventory do I have, where's it at, who's using it, how fast am I going through it, when am I going to stock out, what do I have on order? Just those basic questions that we all would think that every hospital should be able to answer, but they can't because their ERP systems are really focused on how they buy things, not managing it once it gets inside their four walls. So where before COVID, everything was about the OR, hospitals were very focused on streamlining their ORs and their OR processes and getting control of the inventory in the ORs. That's still very important. We're engaged in many conversations there, and we've got a great solution. But now suddenly hospitals are saying, we want to get our med-surg stuff in line. One of the largest health systems in the country has an RFP out. It was all focused on the OR, and literally a half an hour before this call, I got pinged on from them saying, we're expanding that RFP into our med-surg products as well. So I think it's going to be very good for our business. and quite honestly, very good for the healthcare system, because Lord knows that they have not invested in these areas in the past, and their capabilities are very weak, which is what found us in the problems that we have today.
So, John, this is John Yates. I'm going to ask a final question here, if that's okay, Michelle. And this is sort of out of left field, John, but we got an election coming up, and it's going to be interesting to see what happens from a governmental standpoint with respect to the supply chain, the government, the states. Just speculate a little bit here as to what you see. And, when we're Q1 of 2021, what direction do you think we're going to be going? And how does the supply chain model, and particularly the kind of services that you provide so efficiently with your company, how do they fit into one of those models? And we're going to have one or another model, I guess, right?
Yeah, I think regardless what happens on the presidency, because I've been approached by both Democrats and Republicans in the last couple of months, all of them trying to get a foundation in place that will secure us for the next pandemic. So I think both parties are actually very focused on being able to solve that. I think there's going to be a lot of noise about the vaccine and how the vaccine gets distributed, and because that seems to be a very political thing right now. And unfortunately, that has been handed off to the states, and every state's going to figure that out on their own. And so that's going to bring some complexity in. I know the undertone is to really get more of a unified approach to that. So I think you'll see the federal government probably take a heavier hand. It wouldn't surprise me to see a supply chain czar appointed. I know there's conversation about that going on inside the federal government right now. So I do believe that visibility and transparency are going to continue to be the key. And at the governmental level, it's going to be how do we get that visibility and transparency through the entire supply chain. I think Republican or Democrat, you're going to see pushes at the federal level to make that happen. I'm excited to make that happen. We're a cloud-based platform. We're uniquely positioned where we have all of that data sitting in a single spot, and would be very easy for us to see it. And we see it almost in real time. So as things are fluxing and changing, again, consumption of these materials vary wildly day by day. You can't look at 6 months worth of history and figure it out. You got to have something that lets me see what's going on today. So I think the government needs to play a big role in that. I think hospitals stockpiling everything, and this is what I'm telling these government groups that are reaching out to me, hospitals building 6-month, year inventories to be able to do this isn't a good use of cash, isn't a good use of real estate, and ultimately will bite them. I think the federal government needs to take a bigger role in that. I think you're going to see that because that seems to be what's happening underneath, and we're in a good spot to help.
It sounds like Jump Technologies is ready to jump into 2021. And I think from the standpoint of the supply chain issues and analytics and data that you have, it puts you in a unique position. Well, Michelle and I have enjoyed talking with you today. You've got a very exciting company. We're proud to be working with you, and we look forward to seeing great things from you in 2021. We all know that the supply chain and the healthcare community are going to need to be interwoven, and it sounds like Jump Technologies is right there to help. So thank you, John. We appreciate it. It's good to have you today on MMM Tech Law and Business Report.
Thank you for having me, and thank you for all your help.